What's going on YouTube? So today I'm going to talk to you about how my orthopedic surgery rotation went, tips I have for it, and how I think you can make the best opportunity for yourself. Let's get to it. So to start, my orthopedic rotation was a little weird. So I was actually in a rural practicing orthopedic surgery with a standalone hospital that only does orthopedic surgery. So it was the hospital was obviously only orthopedic focused, so that made it like a very interesting environment to learn and to practice. The place I practiced at was a large hospital. I mean, they had inpatient, outpatient, rehab, CT scans, outpatient surgery, inpatient surgery, emergency. They had a helipad, so they had everything. So it was really nice to learn from that environment. The hours were actually really cush. So like I was there most of the time. If I had clinic, I was there from like 9 a.m. to 1 or 2. Really nice. The worst I think I had it was surgery started at like 8 a.m. one morning, and I was there until like 5. But that was like 1 or 2 days. So for the most part, if it was clinic, I was there half days. If I did have to stay the whole day, it was like 9 to 3:30. So the hours were pretty nice. They even like gave us food. They had a cafeteria where everyone ate for free, which was super nice. So I didn't even have to worry about my food. I did commute. It was about an hour drive for me every morning and back. So that was like some days I was driving more than I was in the clinic. So that was like unheard of for surgery. But I think it's like a regular thing for orthopedic surgery. So that's super nice. They didn't have any residents there, so I couldn't see what the residents' life was like. It was only attendings. But the surgeries that we did, I was put with everything from a podiatrist to a knee guy to a dude that only did shoulders, and another guy who just did hips, and a spinal surgeon. So I did like every joint. But the surgeon I stuck with the most was a shoulder person. I don't think I did anything besides shoulders with him. He would do shoulder replacements, labrum tears, bicep tear replacements, things like that. He also did carpal tunnel surgery. So I didn't realize how quick of a surgery that was. It's like less than 5 minutes, which was really cool to see him like sit there and cut through and like immediate relief. Like the patient was wearing like their everyday clothes. Like that's how the carpal tunnel release was super quick. The spine, I never did any surgeries with him. I was with outpatient with him. And then the podiatrist was also there. He was really nice. But for the most part, it was very clinic oriented with a little bit of surgery, where I thought, because this was during my surgery rotation, I thought it was gonna be more surgery, but it wasn't how it was. I did more clinic than I did actual surgery. The shelf was not just an orthopedic shelf, it was for the entire surgery as a whole, so I didn't have to study specifically for surgery. But if you do an elective, like I had a buddy who did the orthopedic elective, they had an orthopedic quiz written by the department. And then you can use a website called OrthoWorlds that has only orthopedic questions on it. That's what orthopedic residents use to study, which I've heard is like very inclusive and includes everything you could possibly need. What I did to like prepare for the day is I would use like an app like Hippocrates or Up to Date, and I would find like articles that talked about what's the best treatment, when do you do surgery, how do you help the patient before surgery. That was a lot of questions that they had for me, is like, what should we do instead of doing surgery as we're sitting in the OR doing surgery. So like physical therapy, NSAIDs, things like that. Know those kind of things like the back of your hand. I wasn't asked a lot of anatomy, which I feel like they only care about anatomy, but like no anatomy was asked for me. And granted, this was my experience. You could have an attending who only cares about anatomy. But for the most part for me, super easy, super nice. Little preparation I had to do for the day of, and the days were extremely short. I would totally do it again. I'm not interested in orthopedic surgery, but it was my favorite surgery by far. But leave a comment down below if you have any different opinions or different experiences, or if you have a specific video that you want to watch or have me make, and I'll make it for you guys. But I'll catch you guys later. Thanks.